You said evening pain.
Evening. I tend to find my pains are on a daily cycle as I move. I mean, for
Oh, cause
instance,
funny enough, that is in my question. Like, if you identify, because I've seen some video where people can identify when they do get a flare up.
fibromyalgia wasn't a diagnosis at this point,
Okay,
and
it wasn't.
there's a certain cohort of people that have lived hard. The more connective, the more collagen fibers you've got, the thicker it gets is when you start to get tendons, ligaments, and things. But as you've got tendons pulling on the surface of the bone, which is called periosteum, which is another connective tissue. It's a thick, a tough, thin layer around the bone. But as that pulls, it's then stimulating the bones to change. Is when you start to get bony spurs and various things.
Right.
Now they show up in an X-ray. Doctors can go, they're running all these fancy tests. But have they examined the physical condition of the patient?
Hi. YouTube have two ways to push your channel. With that said, I'm asking you two quick favors. If you like what I'm doing and want to support my growth, please give me a thumbs up so that YouTube could send my videos out to like-minded viewers just like you. 2. I've noticed that 70% of you who have revisited this channel have not yet subscribed. Please hit that subscribe button. That way my channel will grow. And my promise to you is to give you more content with substance just like these. Do we have a deal? Thank you.
Today, my guests that I have on the Ivy Cancer podcast go by the names of Leigh Blyth. She is qualified veterinarian surgeon with a Bachelor of Veterinary Medicine and Surgery. She also have a medical and pharmaceutical education and a wide range of surgical experience. She is a lifelong animal lover. She suffered with pain all her life. Leigh was hospitalized at the age of 10 months old with scalding to her upper back. Bandage restricted her shoulder and her head posture became rotated and tilted back. She was tested for hypermobile syndrome, but she didn't let that stop her. She grew up thinking it was normal to be in pain. At the age of 7 to 8 years old, she seen an orthopedic consultant x-ray for her bad knee. She still struggled with the concept that people aren't in pain. Welcome to the Ivy Cancer podcast, where we discuss cancer, health, lifestyle, and healing. And today it is no different. Thank you for the opportunity, Leigh, to grant us the chance to interview a wonderful person like yourself. Today we're going to talk about a topic with mainstream media do not talk about that much. A lot of people are affected with this particular illness. Around 160 million people worldwide, and about 4 million in the US. And in the UK, there are about 3 million people with this illness. But before we get into that, your bio is something very interesting. And I cut short with the bio so you can elaborate on a lot of these things. Right? So how are you doing before we get into the podcast? Who is Leigh and what you're about?
Well, right, throwing that. I guess, as I say, I've always been in pain, but the last 8 years, I've been healing. I mean, my body was wrecked, my mind was wrecked. I'd lived in a deep depression for 17 years, and I had no hope of ever getting better. I mean, my depression, I thought was a fault with me. My life was quite good. I had a job, a car, a house, nothing that I should have been depressed about, but I could barely get out of bed other than to get to work. And I really thought it was a fault up here. It was only when a layer of tension, as I was healing, my depression lifted one day. I mean, it was that dramatic. I suddenly felt better. I felt this layer of tension split, release, and I suddenly had hope that I could be better, feel better. And that really came through actually, I mean, everyone says it, people have been trying to explain this for millennia. When you go back to all the yogas, tai chis, qigong, everything starts with breathing and breathing better, connecting, feeling the sensory feedback from my body. Started for me to realize how bad the condition my body was in and how much pain the tissues were generating constantly. And it was the pain that had overwhelmed me. It was almost like my depression was a cocoon to shut me down, to protect me. Because I'd always fought, I'd always struggled, pushed through the pain. I mean, I've climbed mountains with rucksacks. I've fallen off a lot of horses. I was used to pain. And as I say, I never associated with that would affect my mental health. But so much. And I mean, the layers of where you're affected, I mean, anxiety. So many people have anxiety now, but it's also associated with tensions here. Whereas people talk about worry, fear, you know, tensions lower down. I mean, it all goes back, you know, your liver is associated with anger, you know, it's tensions here on your right side, as opposed, you know, wherever, you know, the physical, mental, emotional, it is all connected. And I guess this is me. I'm grateful for where I am now because my experiences have shown me how important it is of how we use our bodies, which muscles we use. And for most people, probably naturally use the right muscles, but I've always been a bit twisted, squint, restricted. And if you're not using the right muscles, you're using the wrong muscles, which causes stress, strain, bad posture. Ultimately, you're in a bad position, you're physically tense, you're getting all this feedback to your brain about tension, pain. It becomes overwhelming.
Okay. We're gonna get into all of that because I want to get to know more about Leigh. At the age of 10 months, you was hospitalized with scalding. What happened?
Yes. I was kitchen at home. Apparently there was a low worktop with a cup of coffee, and I'd pulled the cable of the kettle. I was reaching up, I'd pulled the cable, and I knocked a cup of hot coffee over my back. So that was the start. I'd bandaged, sort of burns, scalding burns, and I think also potentially lying on my front, as I say, my head was tilted back. And my mum always tells a story about how one of the nurses, because she was mortified, you know, picked me up and swung me around by my arm, and that had always stuck in her memory. Just, I think, rough handling. But I've also, I mean, I was a bit of a tomboy. I was always climbing trees and walls, jumping. I did a lot of damage. The first time I tried to do a cartwheel because I had no arm support, I hit the floor. I've never managed to do a cartwheel. This is an aim for me now. I'm one day.
You still want to do a cartwheel?
I would like to be able to do a cartwheel. I've been working on doing sort of handstands in the pool, where I've got support of the water and things. And even yesterday, I did a proper handstand for the first time. So every day is improving. Little by little, releasing the tensions, regaining movement, becoming more balanced. Because interesting, like in a yoga class, I've started doing yoga this year. I can be sitting in quite a complicated pose thinking, what's so difficult about this? Because my hypermobility allows me to move into bad positions where I'm twisted. And yet some of the most basic moves I can't do. I struggle because I'm too tense and restricted, and I have misalignments. So I don't know if you're familiar with any yoga moves, but
I want to get into yoga, but I've been watching some videos, and I know it's something that would be beneficial to me in the future, or my health, you know, but I don't know how to go about it.
Well, yoga actually means union, to yoke, union, the joining, and that's joining body, brain, breath, connections. So everything comes from breathing. The poses you see, the asanas, as they call them, are actually just endpoints in positions when you've got a full range of movement. But for instance, a lot of the warrior poses, they call them, they're like in a lunge. I can't do that and put my arms above my head. So when I'm in a yoga class, I might actually just sit down when everyone else is standing and just practice my arms. And that's actually been a big part of my healing, of not worrying about what everybody else is doing, is actually feeling, you know, from my midline, positioning, moving, and just letting myself adjust, adapt. I mean, I don't know if you can hear the crunches and the cracks and
Oh, really? Is that your bones?
That's my fingers. Yeah.
What the hell?
Well, I mean, everyone, the medical profession, you know, they're saying that's air in joints. It's not. It's the connective tissues. I
Oh
mean, there's
my God, I
layers
never
of
heard about anything like that
the
before.
layers of connect. I mean, I can get my neck to go, or my shoulder.
Oh my gosh.
That's where these, because as I sit here, my shoulder tilts
Is it
forward.
painful when you do that?
It's actually a release.
Oh.
It's releasing the tissues. It feels good, and that the big thing with the baseline healing, using the right muscles, is it feels right. It feels the right thing to do.
Yeah.
And I know a lot of people get scared when they're crunching and cracking, but if your connective tissues are a bit stuck, you're releasing them. And it's very interesting because I can feel the emotions and sometimes memories that come with the movements.
Right.
So yeah, it feels good to do that as I straighten up.
So we're going to touch to the topic of discussion.
Just to feel my ankle. Just needed to do that. When I wake up in the morning, that's the first thing I do is have a little bit of a, sorry.
That's painful.
It doesn't, that's actually good. I will occasionally just have to have a little bit of a cry. And it's often not because I'm in pain, it's just a physical release. And learning to go with that, because again, as a child, I never cried. If I hurt myself, I'd pretend to be okay. And, you know, I absorbed it instead of releasing it. Right. And I look at these children, if they've fallen down on the street, having a good scream, and I think, good on you, you're getting rid of that tension and that damage straight away. But yes.
So
yes.
What makes you become a veterinarian?
I've always loved animals. Always, from a very small child. My neighbour's cat used to come and ride around in my Fisher-Price tractor that I had. I've always got on better with animals than people, probably. I think I would test, you know, testing for autism and ADHD, I will test positive for things like this. And I don't know whether, I don't like all these labels, to be honest. Okay. Because we are all a bit different. We've all got our own qualities in the way we look at life. But I was definitely always more of a animal person than a people person.
Okay.
And a fascination with medicine, you know, biology, how we work, the medical thing. It just seemed natural. I'd always wanted to be a vet. Actually, that's not true. When I was about 4, I wanted to be an astronaut, but I've always been so travel sick. I knew there was no way that that would ever be a possibility. But yeah.
Right. So let us get into the topic of discussion. So as I said before, statistics shows that over 160 million people diagnosed with fibromyalgia.
Yeah.
What is fibromyalgia in your understanding?
Oh, wow. The fibromyalgia label is basically what people are told when they've been going to the doctors with chronic pains over their bodies, but blood tests are normal. You know, they might have had some scans. I mean, a lot of people say that they've had arthritis because if you take an X-ray, you know, bones show up well. And if there's something to see, doctors will be like, oh, that's the problem. But yeah, when there's unexplained pain all over the body, eventually it will just get labeled fibromyalgia. There's certain groups of people that think fibromyalgia doesn't exist. It's a made-up diagnosis. People are just slacking. Other people that are trying to say that it's an autoimmune problem. I mean, there's various studies. What was the previous? Oh, yeah, central sensitization. That was the other label that was coming. It was blaming people's brains, just saying they're oversensitive.
Right.
That for some reason there's been a trigger and they're actually oversensitive. But nobody seems to actually examine the patient to look to see where the pain is. I mean, for instance, my calf muscles are solid. You can feel the spasms, the tensions there. I mean, as you say, if you look at me, if I take a deep breath, I can't do it on the camera, but if I start to straighten up my midline, my head sits like that, because that's where my neck has been sat. And I think that would be one of the first things doctors should start to examine, is the position of the neck in relation to midline, to even see if people are misaligned, imbalanced. There's now fibromyalgia. You've got that's I think it was in 1970, 1980. It's been called various things over time. And interestingly, I do think people that used to be labeled as a hypochondriac, you know, a lot thinking there's a lot of things wrong, but doctors can't find anything. Your hypochondria is actually your area under here, under your ribs.
Right.
Now, this is one of the first areas that starts to get tense.
Right.
When you're tilted forward, your posture's a bit bad, you've got tensions on your ribs. So I do wonder if that's the origins of the hypochondriac label. But now, at least people might be taken a little bit more serious and be told they've got fibromyalgia. But fibro means fibers, and they're talking about connective tissues all through your body. I mean, that's what all the sort of the white stuff here. I mean, there's a good strip on your leg. You know, you've got muscles, you've got connective tissues, and that's the myalgia, means muscle pain.
Right.
So it's connective tissue and muscle pain is the label. But there's so many other things that it then causes. You've got the mental effects of chronic pain. If it's, I mean, as I say, I've always lived with pain. So many of the pains I have, if people had never had pain, they would be absolutely terrified. But to me, they're normal. So if you're new to fibromyalgia, you might have the anxiety, stress, you're getting these pains and weird sensations, because it isn't just pain, it can be electric shocks, itches. I mean, sometimes it feels like the sharp stabbing under a nail, or my very pinprick point in my nose or my ear. It can be some very specific weird things. So that can be incredibly anxiety inducing if you're not used to it. If you're living with chronic pain over a long time, depression hits, you know, you don't want to do anything, you're in pain. IBS, irritable bowel syndrome,
Right.
is the blanket diagnosis that you're given when people are getting sort of intestinal pains, gut pains. Tests have come back normal, can't really see anything. But doctors seem to forget about that muscles and connective tissues can generate pain. Just because you think you've got pain here doesn't mean it's inside your guts. But also, all your organs are suspended with connective tissues. So if there's tension somewhere, it will cause pain in that area.
Right.
Take a breath. Yes, what was I going to say? I need to breathe. Because yes, healing, breathing, relaxing, it's all very good.
So you said in your bio that you were diagnosed with fibromyalgia from before you could talk.
I'm not diagnosed. That's when my symptoms
But the
started.
symptoms. So what are some of the symptoms that led your parents to go find out?
Oh no, fibromyalgia wasn't a diagnosis at this point. And
okay, it wasn't.
There's a certain cohort of people that have lived with pain since a small child.
Right.
But early symptoms, I guess, hip pains, because my leg being a bit aligned, the hip pains, the knee pains, muscle spasms, pins and needles. I don't know if you get pins and needles.
Yeah, I do get pins and needles a lot.
So, I mean, that would be daily.
But isn't that due down to your magnesium levels?
There are many factors that will contribute. Now, magnesium is very important for muscles.
Right.
And it's one of the supplements that you should be taking if you
Yeah,
have got.
because I realized since I start, because I used to have it a lot, but when I take my magnesium, I realize the pins and needles stops.
Get better. So
Yeah, so when I don't take the magnesium, it starts again. So I figure more or less I may be lacking magnesium then.
okay, well, this is it. I mean, there's so many other things that do cause pain and these sensations that you do need to rule them out. But it's interesting hearing that you notice such a difference.
Yeah, because I never normally take magnesium. I normally take vitamin, multivitamins. I normally take like
Your vitamin D, your vitamin K3, and your
yeah,
magnesium, sort of a
zinc
good
and
combination.
yeah.
So, but things like foot spasms, the plantar fasciitis. I mean, as a child, I would sit and my foot would be spasming, and it was almost like to see how long I could bear the pain before I would move. But to me, that was just normal, and I assumed everybody had pain. I mean, I saw the adults around me, they might have a bit of a groan getting out of a chair and stuff. But I mean, talking to my mum, she said as a child, because I said, did I complain about pain? And she was like, well, you would only complain about a thing for a couple of days and then, it would move on, because pain does spread and it shifts around. Our natural reaction is to avoid a painful thing.
Right.
But you change your posture, you twist around, but you're then potentially putting pressure on other parts, and it sort of zigzags up and down the body, round. I mean, I'm sitting here at the moment, my evening pain, particularly around here, is quite bad. But then you get the
You said evening pain.
evening. I tend to find my pains are on a daily cycle as I move. I mean, for
Oh, because
instance,
funny enough, that is in my question. Like, if you identify, because I've seen some video where people can identify when they do get a flare up. So you identify that at this particular time you got a flare up in your.
yes, it's bad at this point in the evenings. I mean, a good example is when I was going to work. I had a sort of 20-minute, half an hour drive, and about 5-10 minutes into the drive, almost at the same spot every day, I would get this really intense pain here. Really, I mean, to the point I'd be putting my head in the footwell to have a bit of a scream at traffic lights.
Yeah.
And it was horrendous. But I would get to work, I would get out of the car, sort of stand up, stretch, that would go, but then my back pain would start to kick in. And now as I look back, I know it's because my posture had changed, position had changed. When I'm in the car driving, the tension's here, but then that's released a bit, but to here. And I think that's a big part of the fibromyalgia. It does shift around. And I mean, people would say, because I'd say, I've got a bad back, and so, how are you today? One, you don't really want to be moaning. Two, to be honest, it felt a little bit crazy. So, well, my back's not too bad, but actually my shoulder and my arm. I mean, at the moment, if I touch, my arms have always been rotated round, but as I've been healing, as things realign, it brings to the surface. Now, just a very gentle pressure there at the moment is quite tender. The muscles underneath. And my biceps are quite tense at the moment. They are quite bad, actually. So, but yeah, it's the myalgia, muscle pain, muscle spasms. When muscles are under stress, they get tense, they get more restricted. And because a muscle is hundreds of thousands of fibers, if a few fibers are spasming, that's when you start to get a knot.
Right.
And that bit of muscle can't be used. but the body will start to use another little bit close by, and it spreads and it moves. And unless you release that tension, that spasm, you carry it around with you. And that's why symptoms progress. The more damage, the more trauma, the more inflammation that you've had on your body, the tenser and more restricted you get, the more pain signals are generated, the more you avoid the pain, the more you change your posture even more. So it's just this cumulative damage.
You were talking about doctors and mentioning about arthritis. Is there any correlation between fibromyalgia and arthritis?
I see arthritis on its purest forms means inflammation of the joint.
Right.
Now, what happens now, you've got rheumatoid arthritis, which is an autoimmune condition. Your body's attacking attacking the joints, causing a lot of inflammation. Now, there's tests for that can show up in a blood test. There's treatments for that. So ignoring rheumatoid arthritis, you have osteoarthritis, which is in the veterinary world, we would call that degenerative joint disease. It's wear and tear. Now, what is actually positioning your bones, what's pulling on your bones is the connective tissues and the muscles. So if you've had tension for a long time, the surface of the bone starts to react. Because see, connective tissues are throughout our body. They come in all sorts of forms, and it's all collagen fibers. But if it's a very loose collagen fibers, you've got fluffy connective tissues. The more connective, the more collagen fibers you've got, the thicker it gets is when you start to get tendons, ligaments and things.
Right.
But as you've got tendons pulling on the surface of the bone, which is called periosteum, which is another connective tissue. It's a thick, a tough, thin layer around a bone. But as that pulls, it's then stimulating the bones to change, is when you start to get bony spurs and various things.
Right.
Now, they show up in an X-ray. Doctors can go, oh, there's a problem, you've got arthritis. But the arthritis is actually just another symptom. The bony changes are a symptom of the tensions pulling. So yes, there is definitely the correlation. The longer you've had fibromyalgia, the more pulling you've had on your joints, the more arthritic changes there will be. If that makes sense.
Okay. So there's a recent study, because it seems to be there's a confusion as to what really causes fibromyalgia.
Everybody's wrong.
And there is a study that it is an autoimmune sickness.
Now, do you know they tested? They took blood from for people that had fibromyalgia. I think there's possibly 8 people in this trial.
Right.
Now, given the figures that you quoted earlier, that's not a representative sample. But yeah, they took blood, they span it down, they injected it into the mice. Mice got a little bit, and then the mice recovered. It's a poor study. It's not actually that new. It was published a few years ago. It's sort of become more prevalent now, but it's been publicized a bit more now. But I honestly, no. If it was an autoimmune problem, it would respond much better to immunosuppressants and corticosteroids.
Right.
Shouldn't say that actually, possibly, because they are a very natural painkiller and will make anybody feel better for 24 hours. But there's a lot of people with the autoimmune conditions, such as rheumatoid arthritis, that are already on treatment, but it does nothing for their fibromyalgia. So it's a very, very poor study. And I would love to see the clinical exam of these people. You could get a broomstick and put it in front of someone and ask them to stand up straight, or even you put your back against a wall. Can you stand up straight? Can you move your shoulders? Very basic tests that aren't carried out. And especially for people with hypermobility, like, I mean, I'd pretty much given up on doctors at the time I was 15, but I've seen osteopaths, chiropractors, physio, you name it. And they do these range of movement tests, do this, do that. Now, especially if you're hypermobile, you can cheat. You know, I could touch my toes, but I wasn't touching my toes in a good way.
Right.
But as far as the practitioner was saying, they would say, oh, you know, you can do that, you can do. But the fact that, say, my shoulder doesn't bend backwards wasn't picked up, wasn't noticed. So,
What are
because there was a previous study.
carry on?
Sorry. Well, there was a previous study in America where they were taking chronic pain patients and they were scanning their brain and they could see changes in the brain.
Mm-hmm.
So suddenly it was becoming a brain problem. But again, that's just a symptom. If you've been in chronic pain, your body has been sending signals to your brain for so long that it's then caused changes. It's not the cause, it's another symptom. It's a very physical problem.
So what are your thoughts then as to what causes really my fibromyalgia? What are your thoughts?
Fibromyalgia.
Yeah.
Well, there's two main things. The myalgia is very much logic based on anatomy. If you're not using the right muscles, you're using the wrong muscles. I think that's basic thing. So if you're imbalanced and you're stressing your body, if you're not using it properly, the muscles get tense, get sore, myalgia. You adjust your posture, you get sort of worse positioning, more and more bits of muscle get sore. See, this would be great where I could actually have illustrations, but you know, if I've got a little bit of a muscle spasm, so I avoid that, but then it comes here, comes here, comes here. So that's the myalgia. Your muscles are sore, they're overworked, they're stressed, they're fatigued. And then the other part is the fibro due to inflammation events. Now, inflammation is a massive topic, incredibly complicated how the body reacts. But one thing that does happen is these collagen fibers that are everywhere, all these white things, instead of being all, I've got the, I should just wonder if the picture will show up. But that's
No, it's
like, that's a microscopic thing of, I think that's actually in the arm, but you can see those threads. Now, those threads with inflammation start to get cross-linked and stuck together, sticky.
right.
Scar tissue is a very good example. When a wound heals, the fibers come in and stick. And the other thing is surgical adhesions. If you know a surgeon's been fishing around in your abdomen, it's caused some inflammation, things then stick together. That's a very good example actually, because it's amazing. I mean, I've mostly on dogs, but when dogs have had previous surgery and then you open them up, the amount of bits that can be stuck to each other. So that the effect of inflammation, cross-linking of collagen fibers, bit sticky, restricted movement, a little bit more tension. And the way we're constructed, there's connective tissue layers from head to fingers to toes. Something to look at is myofascial meridians. I don't know, company, somebody, Anatomy Trains were the first to really put these illustrations for the human. I've got to say, to veterinary surgeons, all this just seems, we knew about all this connections way before somebody pointed it out. But there's, I wonder if I've got any on my phone, but the way these connective tissues go throughout the body, if you've got tension somewhere, I mean, for instance, here, this line up here, if you've got tensions here, see if it will pull all the way down your leg, you know, all the way down to your foot.
Right.
And I mean, I don't know if you know anything about reflexology on the feet. Well, you can look, they'll show you like a picture of a foot and pictures of different organs and stuff. And it's the ends of those threads. So I'll explain. I could really do with some images. But yes, so the pain and weird sensations throughout the body. For instance, this is not a great example. Imagine that was a bit messier than your connective tissues. But if that's in your arm, you know, the connective tissues would be running all the way down. And then you hit a thread, if that's thicker. When that moves into a certain posture, it pulls, it gives attention, it will give you a sensation, a weird sensation, a pain. And that's the fibromyalgia. That's the fibro part of the fibromyalgia. If we're not dynamically balanced and aligned with the full range of movement, we've got restrictions, we've got somewhere that will cause us pain and tension. But because the human body is incredibly adaptable, we just keep functioning. I mean, how many people are walking around with aches and pains, but you know, you just keep going.
Right.
But yeah, but the more you get, the worse your symptoms get. Something like, it'd be nice to find the pictures. Like a systemic, I mean, long COVID, a lot of the things that are coming with that. I think if people have had a systemic inflammation, the whole body has been inflamed, everything's got a little bit tenser, and it starts to cause signs, and it's harder for the body to function. If the muscle cells are restricted, they have to work a little bit harder. They're pulling against more. They tire easily. So it's frustrating because all this seems so obvious to me now, and it's all the concept of Occam's razor. You know, the simplest explanation is usually the right one. And there's people, as I say, you know, you're saying with the autoimmune, you know, they're running all these fancy tests, but have they examined the physical condition of their patient?
So you're saying they need to examine the physical.
They need to have a look at the people and how they're moving, yeah. And it's using the right reference.
These tests not carrying out. They're not doing these things.
No, this is it. No, I mean, people, as I say, like go into a pain clinic. They finally got an appointment at a pain clinic for their chronic pain. They've been waiting years, and they don't get a physical examination. They're just getting a sheet to be told to be more mindful and, you know, do yoga, because that's quite a meme within the chronic pain community. Oh, just do yoga, they say. Now, there is a lot of truth in that if you're using the right muscles. But for someone like me, I was too twisted, restricted. I didn't use it. And the more I tried, the actual more stress I was putting on my body. I mean, every osteopath or physio would give me a set of exercises and I would try, but it was actually causing me more pain. I have to declick my neck at this point. But yes, these pictures, sorry.
Oh,
yeah, I do. A couple of people in the sauna, it says it really goes through them. But I don't know if you can see, for instance, that picture there is like the connective tissues of your back. Now, I find that one to be able to spread your arms in that way. If they'll show up, there's different. It's probably too far away. In fact, if I can find out which one I want.
You were sharing your screen earlier and you don't have any of those on your screen.
I haven't done these yet, but you see though that cross bands there across the front of the abdomen. The blue, yeah. Now that's one of the myofascial meridians I was talking about. There's several layers up and down the head, but you know, if you've got tension somewhere, you know, it will then affect the legs. So, I mean, that's the fibromyalgia, the fibro and the myalgia together. So physical issues, tensions, restrictions, overwork, stress.
So what are some of the methods you use to manage your pains?
For me, it has all come down to better breathing, focusing on the right muscles. And this here, I don't know if you can see your abs, your rectus abdominis, from connecting your pelvis to your chest all the way up here. Now, this muscle at the front should be long and strong. But if it's not, it starts to put pressure on all the back muscles, you know, all the things that go wrong. So basically breathing, trying to activate the right muscles, section by section, and then just letting myself move. So
deep
whatever.
breathing is good for fibromyalgia patients.
Sorry?
Deep breathing is something good for.
The baseline breathing, I call it. But yeah, a deep breath, trying to connect mind to muscles, body to brain, to start to feel the feedback from your body. Now, the feedback might be the pain, or it might be for your sense of proprioception, which is your sense of position, movement, and balance. It's the feedback from your body telling you where all the bits of your body are. But that's describing the position. But for any position, you need a starting reference.
Right.
And if you haven't got that in your head, you don't really know. I mean, that's another thing. People say bad proprioception. I mean, I was always clumsy, you know, things, my arms flying, things going everywhere, you know, spilling drinks, just walking into things, because I lacked that body awareness. So I lacked the sort of that connection with my core pillar of strength here. Because what we've all got is this strip of connective tissue up here. From pubic symphysis, belly button, up to your sternum there. Now, if you start to imagine that white line, because it's a strip of connective tissue, that is your midline. And you become more aware of that by trying to work with these muscles either side, the rectus abdominis.
Right.
But just starting to feel that, starting to feel how squint, restricted, how I was using all these muscles instead of here. I mean, you can see the difference in posture. You know, that's sort of my natural slumped state. But breathing, extending my midline puts me in a much better posture. But it then highlights all the twists and restrictions further up. So everything is moving from my baseline muscles. There's actually 5 main muscles of movement. Your pelvic floor, the base foundation of your body, provides a lot of sensory feedback for positioning in your brain. It's sort of telling you that this is the base, this is where we start from. You've got your back, and then your central line up here. So that's 2, your baseline. You've got your gluteus maximus. I'll stick my bum in the camera. The biggest muscles in your body.
Right.
Powerhouse muscles at the back of your pelvis, but again, providing a lot of sensory feedback. I have to go, and they actually attach to the back of your femur here, like a linear attachment. So if you can feel your gluteus maximus, I mean, it's like you see all the sprinters at the Olympics as they're warming up, they're flashing these muscles, they're getting these working.
Right.
So you've got a linear attachment here. And then this, everyone knows their quadriceps, the front of the leg. But there's only one of the quadriceps, 4 muscles, but there's only one of them that actually crosses your hip joint. The others are big muscles here, but this, your rectus femoris, from your kneecap, all the way up to your hip. If you imagine that, a long, strong pole, there and there, that gives you the feedback for where your leg should be positioned. So you've got the 2 lines of your leg, and then you've got your midline. So if you start to think of those 3 lines, start to be more aware of your body, where the pains are coming from, how the pain changes as you move. So that's 4 muscles. And then for the upper body, this might be a good time to share the screen, actually. I don't know, can you see that? The trapezius muscles.
Yeah, I'm seeing it.
They're the superficial layer of the upper back, but they start from your mid-back, where your last rib is, all the way up to the base of your skull,
Right.
out towards each shoulder. Now, these should be a smooth blanket of muscle, free to move in all directions. I can't. But being aware of that muscle, trying to activate it from your mid-back, pushing up, feeling, connecting to start to feel position of the upper body. But just working with those 5 main muscles, letting yourself move. So yeah, because you've got, if you think of your midline, I mentioned the first 3 markers: pubic symphysis, belly button, xiphoid process of the sternum. If you put your hands on your ears and reach around, you can feel a bump on the back of your head. Now that is the top of your midline, something called your
I feel it.
external. Hands on your ears, feel.
Yeah, I feel it.
Yeah, yeah. So that, if you imagine that's your top point,
Yeah.
your bottom point there, trying to make a straight line there that's free and able to move. So yes, be more aware of your anatomy, being more aware of your positioning, breathing, and just gently moving, but also being kinder to yourself. I think a lot of the fibromyalgia warrior that's always pushed through needs to actually just sit down and look after themselves for a bit, stop doing too much for everybody, but taking that time to rest. Because even stopping for a couple of minutes, taking a deep breath and doing a little bit of stretching can make all the difference to how your day is going. But the trouble is, we're so stressed, we're so tense, we're doing so much in bad postures, either sitting down for a long time at desk,
I am
hunched up.
guilty of sitting down with bad posture. I always sit and tend to stir my back like this.
Yeah. Well, this will take a deep breath and just try and sit up and see how you feel, because
I try to do
actually,
deep breathing in the night before I go to bed.
yeah. With this, just some people call it meditation, some people call it deep breathing, whatever you want to call it. Just taking that time to focus on yourself, to focus on your breath, to start to connect, to start to feel how to move to improve. Because I think
What about acupuncture?
I've tried that. I quite liked it. I mean, everybody's different. Everybody has their own individual trauma imprint, the damage done, the restrictions.
Mm-hmm.
But anything that helps to release that is a good thing.
Okay.
I mean, the massaging, the manual therapies. Somebody else was saying that they've been having cupping, where they put the cups.
I've recently seen something like that. I never even know that was a thing. Cupping.
Cupping, yeah.
I didn't even know that. I just
I've not
recently
tried
see a
it.
video.
I've personally not tried it. But anything that's getting those muscles to release, to get the connective tissue to release a bit. What you need to do is find a good therapist, a good, someone that's going to examine you, going to work with your body. Right. That's not going from a textbook doing this, that they're actually considering your condition. So there's so many things that can help. Ultimately, it comes down to using your body better and releasing those restrictions. I mean, I said I do spend a lot of time in the sauna. I find the heat useful, stretching. I've normally got a hot water bottle at this point on my back here.
Mm-hmm.
I mean, things like curling up, because it's all about releasing the tensions and stretching, but curling up around a pillow to let myself relax my upper body, but having the support. I mean, for instance, I mentioned the feet thing, reflexology. I mean, someone working your feet, it's releasing the tensions throughout the threads of the whole of your body. Don't think I've got a spiky ball handy, but I use my massage spiky balls a lot. Again, movement, tissues, releasing restrictions. So
how are you healing?
How am I?
Are you healing? Or you find yourself healing to comparing to where you were before?
Oh, amazingly different. Just realized I didn't start my camera. I mean, from 8 years ago, I could barely move. For instance, if you're lying on your back, trying to lift my leg up off the floor, I had to use my hands. I couldn't do it. Whereas now people are asking me if I'm a yoga teacher. So yeah. lot more flexible, totally different in my mental state. I had a lot of emotional issues to work through, you know, but I'd find myself crying, sobbing on the bed, and I could feel face spasms. Yeah, but it's all working out those tensions, those restrictions. For instance, restless leg syndrome, which is a very benign name for a very horrible thing, is part of the fibromyalgia spectrum.
Right.
When sort of in bed, especially, you find legs can't stay still, twitching, moving. I think it's the body trying to heal itself. It's trying to stretch. It's trying to release. So much is connected.
Well, Leigh, I think we need to do a part 2 because there's so much to cover where your anatomy is concerned, and you have bring us through so much, and I'm sure people with fibromyalgia appreciate your teaching, because I see you doing some teaching on your page, and I'm gonna ask you in a bit to, you know, direct people to your page, where they could find you, um if they want some help, some advice, some tips.
Yeah.
Uh,
Well, all the anatomy is on my website, baselinehealing.com.
okay,
I'm on TikTok as Twisted Bee Unraveling, because
right.
that's basically what I have been doing. My body was twisted, but slowly unraveling, realigning, freeing myself from the pain and tensions.
Okay. Okay. Um, on this podcast, we have a closing tradition, right? Um, and where I ask a
You're not
guest.
going to ask me to sing, are you?
No.
We're all right then.
So where I ask the guests to leave an encouraging word for the next guest coming up, not knowing who is that guest. So your encouraging word was from Dr. Jason Yohan. And he said, speaking your truth is your gift to the world. So that's your encouraging word.
Speaking my truth is the best gift to the world. That's actually quite appropriate for me. It's difficult because on the one hand, I know I'm right. My healing journey, the way I've changed, the basic facts, logic, the anatomy is easily checked. But yes, speaking my truth.
Thank you for the opportunity, and I'm gonna ask you to send me your link to your website and the link to your social media so I could put it into the description box. And if you have not yet subscribed to my YouTube channel, you can do so you can get the notification when the video is uploaded on YouTube.
Oh, I do have a YouTube account. I've only ever used it once, but I will see if I can log in.
Right.
I used it about 4 years ago. So yeah, you'll be my motivation to join YouTube
Right.
again.
Then you can do that, and then you can give some educations on it as well. Take care of yourself until next week. I will send you a next link for the next week. We could discuss further.
Well, thank you for the opportunity. It's been fun.
Okay.
Got to switch my camera on, but never mind.
No worries. All right. Enjoy your week.
Same to you. Good luck with everything, and we'll catch you next week then. So
bye.
thank you. Bye. Core pillar of strength, your rectus abdominis. As I say, your gluteus maximus gives you that stability at the back of your pelvis, and your rectus femoris gives you the positioning at the front of your body. As for instance, your knees will extend and flex. They don't have much rotation movement. So if there's a little bit of a misalignment, you start to get knee pains. There's tensions within the connective tissues around the knees, pulling. Could be twinges in one way. It could feel like a whole band, but it's a misalignment that's causing stress, tension, pain, inflammation. So that